Hey, it's Dr. Schmidt. So I have 5 success stories for you. 3 of them are related to cancer, and then I have one that's not a success, but it's something that we can learn from. So the first one is a gentleman that's been seeing me for a number of years, and history of seizures, and we're trying to handle that right now. But he was having anxiety, some like brain problems, basically. Last week I put him on a homeopathic supplement for the nervous system, and in the course of this last week, he's significantly better. And I'm just saying this because it's homeopathic, 100% in this regard. And so we can't dismiss homeopathy. It does work really well. It's got to be used appropriately, and the products have to be high quality. The second success is somebody who, he was doing keto through the early winter, fall, and he was trying to get rid of the lymphedema of his legs. And the keto process for him wasn't too smooth. He wasn't doing a very good job. You can call it dirty keto, I guess. But to make it simpler for himself, he learned about the carnivore diet, and all he did was he doubled or tripled his meat intake. And in 1 month, the lymphedema in his legs was 80% better. So that's the second success story. It's a good one for the carnivore diet. All right, the next 3 are all cancer. And these are not my patients. These are the patients of one of my associates, Dr. Taghi Ben Said. And the first one is a person that had his right kidney removed a while ago, and his left kidney now has cysts and a tumor. They did a biopsy to confirm that this tumor was cancer, and it was. He started ketosis in September, and his last ultrasound, this is January right now, his last ultrasound showed no cysts and no tumor. And his GFR was better. GFR is glomerular filtration rate, and it was low and now it's high. So he saved his kidney with ketosis. All right, the next one is somebody who had stage 4 lung cancer. She's losing her voice and she couldn't work. Her job requires that she speak. And she didn't get any supplements from us because there was a shipping problem. So all of her improvement was from the diet alone. And the lung cancer is shrinking. And it was identified through the medical testing. And at the last visit, the doctor said, "I don't understand how this is happening. This is not how cancer operates." So the doctor is baffled because he never sees this in his whole career. People just don't get better unless they're on, standard. It's questionable, but the point is, ketosis was the solution for this case, and the doctor was baffled by that. The third one is a person that had breast cancer, went through the conventional medical treatments, and was clean of breast cancer or any cancer for 3 years, and then the cancer came back in the form of thyroid cancer, and she didn't want to do the standard conventional treatment anymore because she had already been through that. She's looking for alternatives. She contacted us, and Dr. Ben Said suggested ketosis, and she started doing that. And then at the last test through the medical field, the medical doctor said that the first diagnosis was a mistake. I got my notes right here. That was the actual quote. The first diagnosis was a mistake. Well, again, here's another medical doctor that's baffled. Ketosis is the best hope for cancer. It doesn't fix all cancer. And I've had a few patients that were trying it. It didn't work for them. But we now have 7 of my patients. Taghi has 3. And then Carrie Craddock, another associate that works here, she had 1. Her one case was a guy with it was bladder cancer. And she was very happy to have a success with that particular cancer because that's the cancer that killed her father a few years earlier. And we didn't know about ketosis back then very well at all. The last story I want to share with you is not a success. It's a woman that had breast cancer diagnosed a year and a half ago, and it was stage 3 with her first diagnosis. And so she was following the advice of naturopathic doctor, and she started juicing daily fruits, and that was her therapy. And for a year, she's drinking sugar, basically. And the doctor kept saying, "Keep going, you're just detoxing. Keep going. You always get worse before you get better. Well, after a year, she saw me, and I remember I saw her like on a Wednesday, and she goes, I have an appointment with a holistic MD in Wisconsin. We're gonna drive there on Monday, and then I was supposed to see her after that. Well, and I said to her, okay, I'll help you with ketosis. I mean, obviously the juicing's not working. When she saw the MD in Wisconsin, he put her straight into the hospital, which is where she really should have been. She wasn't physically weak, but her breast was like, it was black and it was, not in good shape at all. So, and I was very happy that she went into the hands of this doctor, this medical doctor. But the point here is that if you're going to have success with ketosis in a cancer case, it'll happen in the first 1 to 3 months. The changes occur that fast. If you are in ketosis for 3 months and the cancer didn't change or it got worse, then it's probably not going to work. You can keep going and trying it out. Now, if you choose not to do ketosis and you're juicing, you should have success in a few months, not a year. It doesn't take 12 months. And this whole thing about detoxing, it's mostly untrue. When you do like a vegan diet or a juicing fast or something like that, like the whole detox thing is thrown around too much, way too much. So those are my stories I wanted to share with you, and I'll do this again tomorrow. And hope this is educational for you.